Hi, I'm Dr. Wayne Carpenter. I'm Director of the Counseling Services here at Western New England University. Myself and Professor Colin Mahoney are putting together a couple of short videos to talk about stress, its effects on people, and also give some ways that maybe you can manage it a little bit better in the closing weeks of this semester. First off, though, I do want to acknowledge how difficult a year this has been for you. I can hardly even imagine what it's been like as a student going through what you guys have gone through, especially seniors coming up with missing some of the athletics, missing some of the important senior events, and the incoming freshmen who lost out on graduation last year and lost out on their first year of college experience. Um, I know that it's been very difficult. I also know many of you perhaps have lost loved ones or have known people that you've lost because of COVID and the toll that that has taken. And then you put that all on top of the the overwhelming workload I think many have experienced with the online, the hybrid, and then the in-class learning. So I'm going to today talk a little bit about stress and what it is in general. And then I hope to talk about how it usually affects people. And then I'm going to give a few ways that I think would be helpful to deal with stress. So, what is stress? Well, it's hard to define what it is, but we know it when we feel it, don't we? It's that sense of overwhelm that comes in. Typically, it triggers off our fight, flight, and freeze response. And so when we feel a threat, whether real or imagined, it doesn't matter. When we feel that there's a threat to us, that could be an exam coming up, it could be a big paper, it could be an athletic event coming up. It could be a family situation. It could be a multitude of different things. But when we experience it as a problem, as a threat, then that triggers within us, within the brain, our fight, flight, and freeze response. And what that does, it sends a cascade of biochemicals through our body, that adrenaline and all sorts of things that prepare us for that survival response. The difficulty comes when we have ongoing stressors that continually put us in perhaps a background sense of threat. And over time, that takes its toll. So, cognitively, the way that may affect us is that you may find that not only do you have anxious thoughts, but the anticipation of things creates anxiety. We can't concentrate as well. We have difficulty processing information and we have difficulty remembering information. So think of that in terms of our academics. Emotionally, we'll feel tense, we could feel restless, worry, we don't have the ability to relax, and we might even experience depression. Behaviorally, you may find yourself avoiding to do work, procrastinating. You might find that you have sleep problems. You have difficulty getting assignments done. You're fidgeting a lot. You might have some tremors. You might find yourself, I've had students who just break down in tears because they're feeling so stressed and overwhelmed. You may find changes in your drinking and eating behaviors and other types of things like that. All of those are normal responses to excess stress. Physiologically, maybe some of you have noticed stiffened muscles and joints, clenching of the jaw, particularly maybe when you're going to sleep, on grinding teeth, tension headaches. You may find that you get stomach aches and feel nauseous, tired, shaky. Maybe you've noticed differences in your weight, either gaining weight or losing weight. And I've known many people who say they can feel or they're aware of their heartbeat. Again, all very normal responses to this. And then socially, People respond to this differently and socially. And probably the two main responses is that some people will actually go and they want to seek out friends and seek out others and be with others. Very difficult in these times of COVID and the restrictions that we have here on campus. And other people tend to withdraw under stress. Again, it's all very individual. So, what can you do to help manage all of this? Well, I'm only going to go into a few things. There are many ways that we can do this, and if you find that you're finding yourself with undue stress and you want more in-depth discussion and more ways of dealing with it, you can certainly make an appointment at the counseling center, which I'll talk about in a moment. One of the biggest things that you can do is make sure that you get adequate sleep. And adequate sleep is 7 or more hours a night, more often than not. So many people I know are getting less than 7 hours, closer to 6 hours, some 5 hours. And what happens then, we go into a place of sleep deprivation, which is only going to exacerbate everything else that we've just talked about. Without good sleep, you can't concentrate well, you can't remember well, you cannot problem solve well. Your immune system is more depressed. You tend to be more irritable with other people, and so it affects relationships. All of the things that we talked about just a moment ago about stress can come just from poor sleep, regardless of everything else that we've put into the mix. So getting at least 7 hours of sleep at night with a regular good sleep routine. So winding down about an hour or half an hour before bed, not studying right up to bedtime, but winding down, putting your stuff away. Do something that's not too taxing. Do something that's not too stimulating. Allow the mind that's been really active and the body that's been active to begin to wind down. And then you can fall asleep more easily. I'm going to give you in a moment a technique that can even help you fall asleep a little bit faster. But before I do that, let me talk about another thing that you can do, and that's exercise. Exercise has been shown time and time again in studies to be as effective as antidepressants in dealing with anxiety. Now, it has to be regular exercise, 3, 4, 5 days a week, somewhere in that range, and for at least 20 minutes a day. A little bit longer is good, but really you don't have to be hours and hours with exercise like this. A lot of studies show that 30 minutes of exercise are going to give you the most gain, and any exercise after that, you get somewhat diminishing gains with that. Now, I'm not talking about you have to go to the gym and get on a treadmill or go to the weight room or do anything hard like that. You can do that, and that's wonderful, but you don't have to do that. Those of you that don't like going to the gym for whatever reason that might be, go outside, take a walk. Take a 15 or 20-minute brisk walk outside. And outside's actually a great way to do it. You can build in a calisthenic routine outside. For example, if you went to the back fields by Southwood and you could do something, for example, like sprint one length of the field, drop down, do some push-ups. Sprint the next length, do some squats. Sprint another length of the field and do a set of lunges, and then sprint back to the beginning. That would be high-intensity interval training right there, all on your own without the need for any other type of apparatus. So we can get our exercise in a lot of different ways. But again, exercise, as I mentioned, is as good as many antidepressants, anti-anxiety medications, and antidepressants as well, actually, in dealing with those things. Music can be also a really powerful way of calming us down. Now, some music is activating and gets us energized, and then there's other music that's actually designed to relax us, to bring us down. In fact, There are music programs out there. For example, Dr. Andrew Weil has a CD called Sound Body, Sound Mind. And in this music that he's produced, into each ear goes a different tone. And it's, um, as you can see, it's a different pace. It's kind of like this, coming in one ear than the other. And those tones are embedded in the music. And what they do is they actually begin to entrain brain waves. And so you may be aware that in our normal waking state, we're in our beta brainwave pattern. A little bit slower than that is alpha, which is sort of relaxed but alert state. Then we go into theta, which is the state where we tend to be our most creative. And then delta, which is sort of that deep healing state. And these states also correspond to our sleep cycle. Well, this music of which I'm speaking entrains the brain waves that take you from a beta state to an alpha state to a theta state to a nice delta state. It's like meditation in the way that it affects your brain waves and calms the body, but you don't have to do a meditative practice. So I would encourage you to look out for music such as that entrains the brain and calms the body. But really, any music that you like, that's calming to you, that fits for you, is going to be useful. So I mentioned before, I was going to teach you a technique to help you fall asleep more quickly. And let me demonstrate that for you now. It also deals with entraining our brain waves and slowing them down. And it starts like this. You're going to put your hands, you could do this laying down in bed, or if you're seated, that's fine. Obviously, I'm seated now, so I'm going to demonstrate it this way. But you're going to tap on your thighs or on a part of your body. And again, you can do this lying down in bed. And you're going to tap at a rate something like this, almost like a stopwatch. Boom, 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 like that. Okay? And you're going to do that for about a full minute. Now, a full minute can be a long time when you're just sitting there, right? So you're going to do this for about a minute. Then, after that, you're going to do some breathing techniques. And again, Professor Mahoney is going to go into more detail about breathing techniques. But you're going to do a deep breathing technique. And in this case, it's going to be what we call the 4-7-8 technique. So you're going to breathe in for a count of 4, hold for a count of 7, and then exhale for a count of 8. So I'll demonstrate that now. Now, as you do that, you're going to start slowing down the tapping. And notice when I'm exhaling, I'm making a noise there. I'm breathing out with some force. And then you can just, after you do 4 or 5 cycles of that breathing, you can just breathe easily and normally, but slow down the tapping even a little bit more. And what's happening here, the brain is in a sense responding to the tapping, and the brain waves are following suit, slowing down. And the breath work also begins to slow down brainwave patterns and heart rhythms, and obviously the breathing rate, and slows down the body in general. And what you'll find is that when you do this and then slow it down even more, what you'll typically find is that there'll come a point where the hands almost feel heavy and you'll just stop tapping. And you'll find yourself in a very nice, pleasant state. And just allow yourself to stay in that state. You may find that you drift off a lot more easily. Well, there's a brief overview of stress and its effects. A few things that you can try on your own. And remember, I talked about control and how in a situation like this, sometimes we feel like we don't have control. Well, these are ways you can take back control. You can control your sleep routine. You can control your exercise. You can do techniques like this tapping technique and others that Professor Mahoney will also teach you. And in these ways, we begin to take back control of our mind and bodies, and we can manage and get through this very stressful situation, get through to the end of this term. I hope this is helpful. If you have any questions, you can contact me at the Counseling Services. We're located in the Campus Center, room 249, or you can call us at 413-782-1221. Take good care. Bye-bye.